welcome. My name's John Kurland. I'm an attorney advisor with AEquitas. My colleague Patti Powers and I are really excited to talk to you about working with victims and witnesses remotely. Just to give you sort of a minute overview of what AEquitas is, for those not familiar, we're a nonprofit. We're based in Washington, D.C., made up of primarily folks who are career prosecutors in various jurisdictions outside the U.S. and specialized in crimes involving intimate partner violence, sexual violence, and human trafficking. And what we do in AEquitas is we learn a lot from folks in the field, and we use all that experience that we have and knowledge we learn from folks in the field to develop resources on best practices, be available for consultations or just connecting folks, and also participate in training events such as this. Now, I'm not going to give you the full infomercial. I urge everyone to check out our website, and you can see some of the resources we have that are available for free, both archived webinars and written compilations. There's the line for it. And please urge you to check it out. But Patti and I, one of the things we've done a lot during the pandemic is we were two of the attorney advisors designated to be sort of point persons on COVID-19. So we've had a chance to work with a lot of jurisdictions and talk to folks across a lot of the jurisdictions about challenges and also surprises that have confronted their practices in working with victims and some of the most vulnerable victims. And we want to sort of distill that into maybe some trade-offs or pathways about moving forward in this really short presentation. And I'm going to hand it off to my colleague, Patti, to sort of kick us off what we hope to be doing.
Thanks so much, John. And thank you very much, Chris, for this great opportunity to be here today. You know, we had to work very hard during the pandemic, and I know you did as prosecutors, to ensure that our communication skills were really rising to the level that was necessary when we engaged in virtual communication. And one of the things that John and I have found that we'll be focusing on during this very brief presentation is what we learn from our work has really greatly enhanced our communication skills. And we're able to look at many of the features of our practices as being sustainable and highly beneficial for the future. It all begins with recognizing signs and symptoms of trauma and bearing in mind that the offender in the infliction of that crime has caused a traumatic response from the victim. I think it's also significant that even as we hopefully move toward a new normal, that we need to remember that in addition to the trauma that the victim has suffered at the hands of the offender from the infliction of the crime, we also need to consider the impact of the pandemic on victims. And this may indeed be continuing. Support systems may have dissipated. There may have been illness in the family of the victim, or perhaps the victim has been ill. But many of the conditioning forces of the pandemic may still be impacting victims.
So, and a lot of this sort of spinning off from identifying the impact of the pandemic on victims is then using a trauma-informed practice to try to adapt ourselves and address those concerns that they might have that come up during the pandemic or in this post-pandemic world. Maybe when there's a lot less economic security, maybe when there's a lot less flexibility in current schedules, how are we adapting ourselves to meet victims and witnesses' needs rather than expecting them to adapt themselves to us? Pre-pandemic, especially working with vulnerable victims, prosecution by checklist is not always going to be the most successful practice because each of these folks are individualized, and we as professionals have to figure out our ways to adapt ourselves to them. And of course, the pandemic and circumstances raised by it has had a couple more dynamics that we have to think about, and we also have to be listening to. Because ultimately what we want to do is the same thing on some level that hopefully we were trying to do prior to the pandemic, is use trauma-informed strategies, which are going to be individualized to each victim and each witness, that's going to help them feel safer and also going to facilitate their ability to participate in our prosecution in a case and hopefully be able to receive justice.
These were some of the considerations that were generated from the pandemic. We all knew that being diligent and responsive and responding as soon as possible to victims is important, but we really saw that need exacerbated during the pandemic, especially during the early stages when law enforcement may have been impacted in their ability to respond to victims. Prosecutors were still trying to adapt to changing office schedules and working remotely. But what we take from this is it's always going to be important to exercise diligence in responding to victims as soon as possible. And as John noted, we want to try to incorporate trauma-informed practices into remote interviews, which we may still be conducting. There are many occasions where it's more beneficial to a victim to have a remote interview rather than making the necessary trip to the office of the prosecutor or to law enforcement. Trial preparation, as we've been discussing today, may also be effectively undertaken through a virtual interaction, as well as potentially even trial testimony. So we want to ensure that we're utilizing best practices of being truly guided by our understanding of a victim's trauma when we conduct this work, whether it's in person or whether it's remote. And at all times, if it's the choice of the victim, we need to make sure that we have advocacy support available. And this has been done very effectively during the pandemic, sometimes virtually. And even now, if we're conducting a virtual interview, we can still arrange for advocacy support, either physically present and perhaps distance or through another virtual communication. Victims many times developed a perception that medical forensic service was not immediately available, or their health may have been impacted by presenting to a local hospital or medical office. We need to make sure that we're still thinking about this because we still do have the incidence of the pandemic, which may be impacting victims in their ability to seek necessary medical care and evaluation.
So ultimately, the practices we employ and that we develop, we want to build them around the concept of ensuring access for victims, ensuring access for victims and for witnesses to the court and to the presence. And we want to think about these trade-offs that are involved because of the impact of the pandemic. One, of course, is working with systemic delay. When the pandemic first hit, usually this issue was raised in the concept of there just weren't court proceedings available because courts were stopped. Now, I'm sure a lot of folks in this call are dealing with backlogs. Like, how do we figure out a way to triage our cases? How do we prioritize them? Because the cases that accrued before, they haven't disappeared. And probably most of you didn't get more courts or more staff to be able to deal with this backlog. And if we had the silver bullet answer here, this would be a really valuable PC webinar. And I'm not trying to suggest we do. But what I am trying to suggest is when we are confronting and looking at how to triage and prioritize these cases, that we look at our victims' point of view as well. And obviously there's other pressures such as maybe speedy trial impacts and speedy trial limitations, but consider like when we have victims who need court access more quickly, who need resolution of the case, that we figure out how to factor that in whatever sort of balancing process we're using about how to bring our cases to court. Interviewing and providing services to victims. Maybe some folks through remote proceedings, maybe your multidisciplinary muscles have got sort of lax during the pandemic. Maybe you didn't have the multidisciplinary partnerships in place before it started. But this might be a time to start really thinking about how to develop those so that you can center services around the victim and figure out different avenues to meet victims' needs, maybe some sort of needs which you didn't anticipate in pre-pandemic times. We also want to look at options, and this is why I was so fascinated to hear everyone else's presentations today, especially with virtual presentation and virtual testimony versus in-person testimony. We want to, now that we have other models of what can work, we do want to think about ways maybe we can accommodate victim presence or participation in court at the same time while we consider what's best for the case, part of that calculation being what's best for the victim. Maybe our victim really doesn't have childcare issues, and if we have the opportunity for virtual presentation of testimony, maybe that's something we should consider and be more flexible about. Same thing with virtual presentation technologies, whether it's Zoom, whether it's some sort of closed circuit technology or teleconference, remembering that when that is suggested to the victim or being encouraged for the victim, that we want to be respectful of any sort of privacy concerns or safety concerns they have with doing that. Maybe they would be more comfortable coming in with court because on some level it makes them feel safer. They don't have to be worried about someone screen grabbing or screen recording what they're doing and such as that. These are all sorts of issues we want to be sensitive to and alert to.
Sorry to
And-
interrupt, there's about 5 minutes left.
Oh, thank you so much, Abby. As segueing into privacy issues, we recognize some challenges regarding virtual platforms. And all of us here on this call know that there's a potential of live streaming and impermissibly recording and disseminating information. From a victim's perspective, there's also a concern with unknown persons viewing the victim's statement or the victim's appearance at pretrial or trial. So we've really focused on the necessity of asking the court to admonish the public and parties at the beginning of the proceedings that there is going to be no copying or dissemination of this record. And through Zoom, we also know that there's the potential of substituting a name for a telephone number in some software programs to try to really protect the victim's privacy. Whether we're going to utilize virtual platforms or not, we need to be aware that especially coming from the fallout of the pandemic, there are seriously legitimate privacy issues that we need to focus on and certainly do our best to alleviate the victim's concern.
So we do, I was very interested to hear Eric's comment about the work from home trade-offs. And prior to the pandemic, it's something that wasn't even considered. And post-pandemic, the work at home option maybe has some advantages that we didn't get to think of before. And it's, I think, a lot of the same way about working with victims and talking to victims through virtual platforms. Prior to that, I never would have recommended. Always talk to the victim and meet with the victim. And what's surprising, and one of the big surprises during the pandemic, is that it does have some benefits or some virtues that we should think about when we're weighing about deciding about options about how to work with our victims and witnesses. But virtual platforms with Zoom, probably one of the biggest advantages, flexibility for scheduling. We can adapt ourselves to the victim's schedule more easily and maybe their childcare needs. Some folks, because everyone's individual, the remoteness of having the virtual platform might make some people feel more comfortable rather than bringing them into the courthouse or prosecutor office or law enforcement environment and meeting you face to face. Some folks might actually feel more at ease. In some circumstances too, with proper warning to people, especially for our law enforcement partners, if there is a need to record an interview and to memorialize a statement, virtual platforms allow that to be done quite easily just by clicking a button. Now, of course, there's ways to do that live, but I think sometimes it's a little bit more of a production.